4 years of planning and logistical hurdles, culminating with Thursday's ribbon cutting for the Lower East Side's newest behavioral health facility.
People with mental illness and substance use deserve better.
The Mount Sinai Health System touting this as the largest private investment in mental health care in New York State history. It is designed to create a new path toward recovery called step-down care. It will fill the gap between acute psychiatric care that someone might receive at one of the city's public hospitals and a return back to their home or the streets before they are ready. Dr. Grant Mitchell is Mount Sinai's chair of psychiatry.
It's a full continuum. So if you come to this center, no matter what your needs are, we have a service that can serve your needs.
The facility will operate on a voluntary admission basis, accepting walk-ins and outside hospital ER referrals. There will be a mix of offered services among some 130 beds, split between short-term crisis and maximum 2-month inpatient stays. An integrated dual state license will also allow for outpatient treatment of addiction and mental health issues under the same roof. David lives on the Lower East Side.
It's definitely needed. Think about 40 or 50 years ago, the government stopped subsidizing mental health facilities and basically tossed everybody out into the street.
The center is located in the former Rivington House. Beginning in the 1990s, the school building later operated as one of the largest residential spaces in the city for people living with HIV and AIDS. The new facility has the support of several elected officials, including State Mental Health Commissioner Dr. Anne Marie Sullivan, Manhattan Borough President Mark Levine, and local council member Carlina Rivera.
I cannot tell you how often it is that people who are living with mental health issues are criminalized and end up in Rikers instead of in a place where they can receive programs and services and feel welcomed and feel a part of the community.
One of the biggest challenges that New York has right now is the unmet needs of our fellow New Yorkers who are struggling with mental illness.
Mount Sinai is private and well-funded, which means profits and losses matter. So the fact that it's spending $140 million on this new facility says something about its commitment to mental health, especially when you consider the executive leadership, most of whom are trained psychiatrists, say Mount Sinai's behavioral health division lost $24 million last year. These new mental health beds are expected to go online within the next few months.